Hi everybody, welcome to week 6. All right, we are getting there. So this week we are still going to be focusing on assessment and evaluation strategies, but instead of looking globally, we're going to get down and talk about some nitty-gritty assessment strategies. So for the DQ this week, you're going to be IDing assessment strategies for each of the three big learning domains. And I would encourage you to think outside the box a little bit and try to use strategies that you're not like automatically using or the most common ones that you're familiar with, okay? Try to look at maybe some new strategies to add to your toolkit. Remember, the more you put into the assignment, the more you will get out of it and maybe be exposed to some new things, okay? So I want to share with you a formative strategy, assessment strategy that I used during one of my med-surg courses. I hope I have not shared it with you before. If I have, I'm very sorry. I teach a lot of classes. Anyway, let me tell you about it. So I was teaching a med-surg course, and we were talking about diabetes, okay? So I had a quite lengthy class period. We started out with going over some of the pathophysiology and things like that, and I wanted to have a hands-on component, a little bit of cognitive, and maybe even a little bit of affective. So what I did is I set up stations around the room, and so people went in small groups around to the stations. Some of them were simple, some of them were a little more difficult. So the first one, there was a meal, and they had to figure out the number of carbs in the meal for carb counting. The next one is they had to calculate an insulin drip rate for somebody just starting on an insulin drip. Then they had to go and I had some pumps set up, and they had to set up the drip, put it in the pump, get it all going there. Then another station, there was several different scenarios, and they had to calculate the sliding scale doses for those patients. And then the last station was a case study of a diabetic patient with family and a lot of psychosocial kind of components. And they had to come up with some nursing diagnoses and nursing actions to help out this diabetic patient and their family. So I tried to hit on a bunch of different learning domains where they could apply some different things. My kinesthetic learners were really happy because they could get up and were moving around. So just a different way of thinking about part of a class period. It wasn't lab, it was part of my regular class period, but I really felt that the students could apply some of their learning to these particular stations and that would help them. Okay. All right, so a couple things coming up. I want to remind you that week 7 midterm clinical evaluation is when that is coming up. Now, please do your best to have your preceptor complete the midterm evaluation by the end of week 7. We're dependent on our preceptors, right, to complete these. So sometimes that's a little more difficult. Now, if you started your practicum a little later, not at the right beginning of the course, and if you, or if your preceptor would like another week or 2 with you before they fill out their midterm evaluation, that's okay. You just need to write me a note in the individual forum and let me know that that's the case. So that's coming up, just to let you know. You might want to print that out and just give it to your preceptor or email it to your preceptor just so they know the types of things that are going to be on there. And then week 6, it's an even week, so we've got another NEPD due. I think you guys are all getting into the hang of it now. Evaluate in the last column the last 2 weeks, fill out the first 3 columns for the next 2 weeks, and you'll be in good shape. Okay? All right, so I'm really looking forward to seeing what assessment and evaluation techniques you come up with. Remember, they can be formative or summative, either one. That is just fine, and I'm really looking forward to discussing those with you. And I think that's about it. It's a short one this week. I'll see you in the main forum.